Depression. It's more than just feeling blue. It's a heavy weight on your shoulders, dragging you down. Depression affects your mind and body. It impacts how you feel, think, and act. Symptoms vary, but can include persistent sadness and hopelessness, feeling empty inside, loss of interest in things you used to enjoy, changes in sleep patterns, sleeping too much or too little, difficulty concentrating, feeling foggy and indecisive. Depression is a serious medical condition. Don't suffer in silence. Seek help. Remember, you're not alone. There are effective treatments available. CBT is a type of therapy that focuses on the connection between your thoughts, feelings, and behaviors. It's based on the idea that negative thoughts can contribute to depression. Here's how CBT works. Identifying negative thoughts. CBT helps you become aware of your negative thought patterns. Challenging those thoughts. You learn to question and challenge the validity of these thoughts, replacing them with more positive ones. CBT teaches you to replace negative thoughts with more realistic and helpful ones. CBT is a structured and goal-oriented therapy. It often involves homework assignments to practice new skills. Imagine this. You make a small mistake at work and immediately think, "I'm so incompetent. I'm going to get fired." Identify the thought, "I'm so incompetent." Challenge it. Is it true? Replace it. Everyone makes mistakes. This one mistake doesn't define me. Consistently challenging negative thoughts can improve your mood. Section 4. Psychotherapy. Exploring the depths of your emotions. Psychotherapy, also known as talk therapy, delves into your past experiences and unconscious thoughts. It explores how these factors might be contributing to your depression. Here's the premise of psychotherapy: uncovering hidden conflicts. Therapy helps you bring unconscious thoughts and feelings to the surface. Understanding your past. It explores how your past experiences might be influencing your present. Developing coping mechanisms. Therapy equips you with healthy ways to manage difficult emotions. Psychotherapy provides a safe and supportive space to explore your inner world. Section 5. Psychotherapy in practice. Uncovering hidden conflicts. Struggling with perfectionism and fear of failure. Psychotherapy helps explore the root of these patterns. You might uncover childhood experiences of inadequacy. This understanding helps recognize how past shapes present. Develop self-compassion and challenge perfectionism. Reduce anxiety by addressing underlying insecurity. Psychotherapy can heal old wounds and break negative patterns. Section 6. Weighing the scales. CBT versus psychotherapy. Both CBT and psychotherapy are effective treatments for depression. However, they differ in their approaches. CBT focuses on present thoughts and behaviors. Structured and goal-oriented, often shorter in duration. Psychotherapy explores past experiences and unconscious thoughts. More open-ended and exploratory. May require a longer commitment. The best choice for you depends on your individual needs and preferences. Section 7. Choosing your path. Finding the right therapy for you. Choosing the right therapy is personal. Consider these factors: your preferences, structured or exploratory, severity of depression. CBT, for mild, psychotherapy for deeper issues. Therapist's expertise. Find a specialist. Take the first step towards healing.